Good evening, everybody. Thank you for joining us for the IDF Forum, Integrative Medicine and Primary Immunodeficiencies, Considerations, Communication, and Coordination of Care. I'm Kathy Antela, Vice President of Education at IDF, and before we begin, a quick disclaimer that the information presented during this event is not medical advice, nor is it intended to be a substitute for medical advice, diagnosis, or treatment. Please always seek the advice of a physician or other qualified health provider with questions concerning your medical condition. Well, welcome. On behalf of all of us at the Immunodeficiency Foundation, we are so glad to see you with us this evening. And whether this is your first time joining us or whether you have joined us for every single forum since the pandemic began, we are so glad you are here. IDF's mission is improving the diagnosis, treatment, and quality of life of people affected by primary immunodeficiency through fostering a community empowered by advocacy, education, and research. This means that we are committed to serving you and providing you with the tools and resources needed to be your own best advocate and a champion for the PI community. It is by offering these tools and resources that IDF can fulfill its vision of seeking to ensure that everyone in the U.S. affected by primary immunodeficiency has a fully informed understanding of the PI diagnosis that affects them, all available treatment options, the expected standard of care, and all of their opportunities for connection and support within the PI community. This forum and all of our forums, in addition to many, many other programs, are supported by our wonderful sponsors. It is due to their partnerships and contributions that IDF is able to provide programs such as this one and services to everyone in the PI community. So thank you to our 2021 sponsors: Core Services Leaders, CSL Behring, Grifols, and Takeda; Core Services Supporter, Horizon Therapeutics and Octapharma; Core Services Sustainer, Accredo; Core Services Contributor, ADMA Biologics, Bioproducts Laboratory, Farming Healthcare, and X4 Pharmaceuticals; National Patron, Kedrion Biopharma; and Community Partner, Celio Health. Upcoming events. Ongoing nationwide, we have IDF Get Connected groups, and these are small gatherings, all held virtually at this time, where people can get together and get support, meet others in their community, and just have a good time. Now, we have a forum coming up next week, and it is about caregiving. It is the role of family and friends in chronic illness, creating a win-win situation. So whether you're a caregiver or an adult who has family and friends in your life that support you, this will be a wonderful opportunity to learn how individuals with chronic illness and the caregivers can support and benefit each other. Coming soon, June 23rd through the 26th, one of the largest gatherings of individuals with PI in the world will be offered virtually. And right now we have over 1,400 people registered for this event. There is no charge, and there are opportunities to learn, connect, and have fun for all ages. So register now, because there is a limit as to how many people can attend. And then even if you're not able to attend, but you want to view the recordings after the event, in order to see them right after the event, or even while the event is still on, you need to register. So check that out. It will be an amazing event. And right now, I would like to introduce my colleague, Angela, who is going to talk about a fun activity coming up in August. Angela, take it away.
Thank you, Kathy. So I'm really excited to introduce an IDF virtual do-it-yourself fundraiser that we are doing on Wednesday, August 4th at 7:30 p.m. So whether you're a talented chef or someone who doesn't know how to cook at all, like myself, you definitely want to check out this event. For a donation of $20, you can come enjoy an evening with camaraderie with your friends, with the IDF PI community, and you can just have a great time. Now, you guys are the first ones who are going to hear the menu. I just got it today. So we will be making a jalapeno basil lime martini, a panzanella salad, and a faux key lime ice cream. And even if you don't maybe particularly care for an item, you can modify the ingredients however you see fit, because it's your house. You can do it however you want it. So go ahead and register now by the link that lovely Ashley put in the chat. And if you have any questions, email diy@primaryimmune.org. And I hope to see you there. I know I'll be there, definitely learning some new skills. Thanks, Kathy.
Thank you. It sounds like a great time. I can't wait. So now I would like to welcome and introduce our presenter, Dr. Maeve O'Connor. Dr. O'Connor is board certified by both the American Board of Internal Medicine and the American Board of Allergy and Immunology. She has also completed the University of Arizona Fellowship of Integrative Medicine. Dr. O'Connor sees patients at Allergy, Asthma, and Immunology Relief, which is located in Charlotte, North Carolina. So at this time, please join me in welcoming Dr. O'Connor.
Hello, everybody. Wonderful. Well, I'm excited to be here tonight. And it looks like we have a lot of participants, so that's very exciting. So tonight we're going to have a little bit of a different kind of lecture than we usually do at some of these things. It's not going to have a lot of graphs and a lot of p-values and a lot of statistics and things like that. This is much more a practical presentation. I don't even want to call it a lecture. Just talking about, obviously, primary immune deficiency and just some considerations, communication, coordination of care with a little integrative medicine twist for you. So thank you all for being here, and we'll get right into it. If I can advance these slides. I'm never good at the technology part. There we go. So I know some of you are recently diagnosed or newly diagnosed, and then I know that others have had primary immune deficiency or PID for a long time. So this talks, hopefully you'll get something out of it. We're going to talk a little bit about initial diagnosis and then go from there. So the first question is, you know, I have PID, or someone I care about has PID. Now what? You know, that's not news you just give to somebody and then say, okay, I'll see you in 6 months. It was great meeting you. There's a lot of things to consider. Obviously, what the diagnosis is specifically, does it affect other family members? What kind of treatment do I need? And what about all these other considerations, right? So that's what we're going to talk about tonight. So the prognosis of PID is actually really good. It can be a daunting diagnosis, as I mentioned, but honestly, rarely do major life changes need to be made in response to the diagnosis. Modifications, yes, but major life changes, not necessarily. Most people who have been diagnosed with PID are able to live full and relatively, I put that in parentheses, normal lives. Obviously, the modifications need to be made, but a full and normal life is what we want for our patients with PID. The number one thing to do is adopt a healthy lifestyle, and then you can be sure that that full, happy, active, normal life can be achieved. So the first thing I want to say is, you know, again, when you get a diagnosis such as this, you think about all the stress that can come into you, and you don't even hear anymore what your practitioner, whether it's your immunologist or one of your immunologist representatives talking to you about the diagnosis, the first thing is you get kind of stressed out and what does this mean? And there's all kinds of questions. The first thing I tell anybody when they're in any stressful situation is to simply breathe. I know it sounds simple, but it's something that we all forget to do. When people are very stressed out, they stop breathing or they start doing what's called shallow breathing, which is not good for anybody and actually makes stress levels go up. So I'd like to introduce you to the 4-7-8 breath. So what you do is you breathe in through your nose for a count of 4. And yes, I'm going to ask you all to do it. I can't really see all of you because there's too many of you. But I'm going to have you breathe in through your nose for a count of 4. So, and then hold that breath for a count of 7. So keep holding it. And then I want you to release the breath from your mouth with a whooshing sound for a count of 8. So when I do this with patients live, they say, why do you want the whooshing sound, Dr. O'Connor? You're so crazy. And I'm like, no, the whooshing sound is you getting rid of all the stress and all the anxiety that's going on in your life right now. So you're going to breathe in for a count of 4, hold your breath for a count of 7, and then breathe out for a count of 8. And if you can do this, repeating that entire sequence 3 to 4 times in a row, and then just start breathing normally, you will see that your heart rate's going to go down and you're going to feel a lot better and be able to get through whatever stressful event is going on, whether it's a diagnosis of PID, whether it's something you've been exposed to somebody with an infection. This actually really does work. And I can attest to it because I do it all the time and it works great for me. So why does this work? Why is Dr. O'Connor up here telling me how to breathe? This seems silly. Well, it's not. So when you take the shallow oxygen poor breathing that you normally do when you're stressed out, you have to turn it upside down with the 4-7-8 breath. When you're under stress and you're breathing like that guppy kind of breathing that I mentioned, that leads to a little bit of mild hypoxia, otherwise known as oxygen deprivation, which again, as I said, makes things worse. It can lead to a buildup of excess carbon dioxide in the tissues, which then leads to oxidative stress, more inflammation, and acidification in your body. And all of that is a foundation for disease. You know how they tell you that stress is bad for your health? Well, this is one of the reasons, and this is the simplest thing, right? We all breathe how many times a day? And we don't think about, if we're not having healthy breath, we can actually be setting ourselves up for infection, inflammation, autoimmune disease, and other things. So breath is very, very important. Another thing to think about when you get diagnosed with PI or have a question about it is to use your resources. I think when we get stressed out, it can be very easy to become like a deer in headlights and forget that there's all kinds of resources like the one that we're here with tonight, right? IDF and all of our wonderful sponsors. But any question that you have is probably on one of these websites, either the IDF or the college, the Academy of Allergy, Asthma, and Immunology. There's also local support groups, your PCP, your primary care, and your immunologist, as well as your family, friends, if you're a churchgoer, your pastor, other members of the church. But all of these resources are something that you just definitely need to utilize. I don't like to use the word take advantage of. I like to say utilize, because that's what these resources are for. And that's why we're doing this program tonight. And that's why I'm so excited to be here. So talking a little bit more about general health considerations with PID. So we talked about breathing. Now we're going to talk a little bit about nutrition. So poor nutrition, as you all know, can lead to many different types of illnesses. And of course, in the case of the PID individual, this can lead to an increased risk of infections. And already being at risk with PID, we certainly don't want to fuel any further risk by having poor nutrition. Several ways to do this is increasing the variety of foods that you eat. There's lots of research now on processed foods and how bad they are for you, leading not only to inflammation, but it's also been indicated as one of the risk factors for pancreatic cancer and other types of cancers. Maintaining an ideal body weight. I know that's been hard with COVID. Everyone put on their COVID 15, 20. I've seen people with a lot more than that, but trying to really keep your BMI in check, making sure that there's adequate starch and fiber in the diet. And again, you're going to say, Dr. O, we know all of this, But when we have toxins in our bodies from either bad food or other things, environmental factors, even pollution, we want whatever comes into our body to get out as fast as possible. And that's where the starch and fiber will come in. Limiting the intake of fat, cholesterol, sugar, salt, and of course, alcohol. A lot of people turn to alcohol when they're in a stressful situation. Certainly, we do not want that to occur because that is also a setup for disease, addiction, and all the others. Organic foods can be more expensive, although I've been checking prices lately and they're pretty comparable to regular produce. So I do suggest organic for the avoidance of pesticides and other things that can be found, particularly in the peels of fruits and that kind of thing. So the anti-inflammatory diet is one that I think is pretty simple to follow. You can get a copy of this on the Integrative Medicine website of Dr. Andrew Weil, W-E-I-L-L. This is a very wonderful diet in that it does have that variety that I mentioned that we need. Having the most colorful plate that you can. You don't want to be eating a lot of beige foods. You want to have a lot of green, red, purple. All of those colorful foods have the most anti-inflammatory and antioxidants that really help get rid of that inflammation or at least minimize it as much as possible. You want to have fresh food rather than processed or frozen or canned. And again, we've talked about the processed foods. Fast foods, easy to get. It's easy to, especially during COVID, getting out of the house and running through a drive-through, but you want to avoid fast foods as much as possible. And avoiding foods that have hormones, antibiotics, and GMOs. And these are buzzwords now. Very, very, very important to be careful about what's going into your body so that we can be sure to keep inflammation down, risk of infection down, and hopefully beat some of those other risks that PID puts you at, such as malignancy and things like that. So what about supplements? What if I just don't want to eat that much? What if I don't have the time, the energy? Is there anything I can do from a supplement standpoint to help my nutritional status? So there is some scientific evidence that some products will boost the immune system or make it stronger. But you have to be really careful when you're taking any of these products or even considering taking any of them. Because obviously, if somebody's trying to market a product, they're going to make it sound like it can, oh, this will cure your immune problems. This is going to make everything all better. And you want to make sure that you pick products that are actually steeped in science and actually have some data behind them. Because some of the supplements can actually be harmful or interact adversely with some of your prescribed medications. So you should always ask your immunologist's opinion before starting any supplements. And this would include vitamins, electrolyte supplementation, probiotics, and always remembering that supplements are not a substitute for the balanced diet that we were discussing earlier. So getting into a little bit more detail about the anti-inflammatory diet. So fish oil, I'm sure you're all familiar with fish oil, and we've heard about it with having cardiac protection, but in capsule or liquid form. And this is like 2 to 3 grams per day. And you want a product that contains both the EPA and the DHA. You also want to look for molecularly distilled products that are certified to be free of heavy metals and other contaminants. If possible, if you're a vegetarian or vegan, there are plant-based fish oils that are available. It's not a fish, it comes from seaweed actually. So you still can get the EPA and the DHA if you're a vegetarian or vegan, and you don't have to have the seafood in your diet if you prefer to keep seafood out of your diet. If you're not eating ginger or turmeric regularly, these are both high anti-inflammatory supplements. You definitely do want to supplement with these. There's plenty of studies that show anti-inflammatory properties, which again can thwart that pro-inflammatory state, pro-infection state, and pro-malignancy state that you're at risk for with PID. Another supplement that I find very helpful in patients is CoQ10, taking 60 to 100 milligrams of a soft gel daily. This is not like a EPA or DHA capsule where sometimes you can get sort of some stomach GI upset. You can kind of burp it up and taste that sort of fishy oil from the fish oil. This one you do not get that with. But if you do have a problem with that with fish oil, if you keep those capsules in the freezer and take them straight out of the freezer, by the time they warm up and are going to get digested, you won't be able to burp up and taste that. So another simple thing to do is to remember to drink plenty of water. Now, a lot of people say, well, I drink plenty of Coke, I drink plenty of soft drinks, I get lots of hydration, but I'm not talking about hydration. I'm talking about pure water or drinks that are mostly water, like tea or diluted fruit juice, sparkling water with lemon. And of course, you want to use bottled water or get a home water purifier if your tap water tastes of chlorine or other contaminants, or if you live in an area where the water is known or suspected to be contaminated, because there are not only bacterial infections, but there are also other infections that you need to worry about in water that may not be pure. So that's another consideration. So the use of herbal supplements is common, but again, as I was mentioning earlier, you got to be careful with these. These are not considered drugs, so they're not regulated by the FDA. There is, again, as I mentioned, some scientific evidence that they can boost the immune system, but you got to be careful. You got to watch and make sure that there's no interactions with your medicines. Pharmacists can help looking at those interactions, but I always say talk to your immunologist. Always, always, always. And sometimes your provider may recommend vitamins, electrolyte supplementation, or probiotics. But remember, again, supplements are not a substitute for a healthy, balanced diet, which, as I said, I've checked the prices and it's not as bad now as it was pre-COVID. Again, avoiding alcohol. You want to be able to enjoy alcohol, but do that in moderation. Of course, no smoking or any tobacco products. I know a lot of patients of mine say, well, instead of smoking, I'm going to do vaping because it's better. But we know that vaping is not safer. And there are plenty of studies that say that we don't even know what's in some of the solutions that are that the vaping are utilizing. And again, not really being regulated. That's getting better, but we're not there yet. The other reason, of course, other than not wanting to get cancer from smoking or other tobacco products, but respiratory issues you're already at risk for respiratory issues with PID. So you definitely do not want to increase that risk in any way, shape, or form. And obviously, I have to say, avoid all drugs, recreational drugs. Nobody benefits from these, and certainly PID you wouldn't. So you're probably wondering why I'm talking about these things. Well, again, we talked about stress. And when people are stressed, they tend to lean on something that may not be a healthy choice, such as alcohol, tobacco, or other kind of recreational drugs. And we don't want that. So thinking again about nutrition, this seems overwhelming. I mean, it seems easy. She's talking about water. She's talking about fruits and vegetables. I know how to do that. But if you really, really have sort of an unhealthy eating habits, you may want to think about seeking the help of a nutritionist. Local farmers markets are typically, at least here in Charlotte, our farmers markets, I know the farmers there and they're wonderful. They'll answer any questions. They usually know a lot about the nutritional value. There's tons and tons of healthy recipes online, and cooking can be a fun hobby, which can also be a stress reliever for you. You could also garden. If you don't have a lot of land or you live in an apartment, they do make tower gardens now where you can have a huge vegetable garden in just 6 feet of air that goes vertically. Another fun thing to think about is, well, I don't know, I don't want to cook a big meal just for myself, or it's only me and one other person. Well, make a big healthy dinner and invite friends over. That will also help with the stress and impact of having PID. And now that we're allowed to have people over again, this is a good time to start that. Okay, so we've talked about breathing, we've talked about nutrition, including diet and supplements, and now we're going to talk a little bit about exercise. So obviously we all need to exercise, and it's good for our bodies, it's good for our souls, but it's also good for our minds. Every time that I exercise, my stress level goes down. I just feel so much more clear-headed. And I know that this is the case for all folks when they actually start. It's an excellent stress and anxiety reducer. So many different options. And people say, well, I just don't know what to do. It's too hot to run outside. I don't want to do that. Well, there's swimming, there's biking. Running, of course, is an option. Even walking can promote lung function, muscle development, strength, and endurance. So if you're just starting out and maybe you are a little bit unhealthy or a little bit overweight, just start walking. You know, as they say, the beginning starts with the beginning, and you can't look at where you have to get to. You just have to go every day and just have a little bit of progress every day. And then you can end up being a routine exerciser. and be at your maximum health. Organized sports may be a really good outlet for children who are struggling with coping with their PID. My goal in taking care of any of my patients, including those with PID, is that I want my patients to live as normal a life as possible. And particularly when you're thinking about children who can be stigmatized or bullied, especially with having a chronic illness, we really want our PID kids to, quote, just be a regular kid. So organized sports is a good way to help foster social interactions, but also leadership, exercise, and of course, the appetite will go up. And hopefully, if there's healthy food in front of them, they'll eat that instead of eating junk food. Now, there may be some kinds of exercise that could be contraindicated for people with specific immunodeficiencies. So in other words, somebody who has Wiskott-Aldrich syndrome, contact sports are contraindicated. And in patients with chronic granulomatous disease, you got to be careful of swimming in the ocean or fresh water due to susceptibility to organisms that are in those water sources that can create infections in CGD patients. So again, I'm going to say this probably a million times, speak with your immunologist, make sure that you're communicating and that you're getting good answers to your questions before you start any of these things that I am pointing out to you tonight. So what's another one? Sleep. So what does stress do to sleep? Well, it can either make you have insomnia where you can't get any sleep, or it can make you have what we call as fitful sleep or sleep that is not restful. All of those things, again, lead to increased inflammation, increased risk for infection, and just an overall bad mood, right? So you want to try to get a consistent number of hours of sleep every night. This whole concept that you can catch up on the weekends if you're busy during the week, that really is not true. That's been shown over and over again to actually be bad for you because your body wants that routine. There's many studies that have shown that erratic sleep patterns have negative effects on the immune system. So if you already have a weakened immune system or lack of an immune system, sleep is very, very important as the breathing, the nutrition, the hydration, and the exercise that we've talked about. So you want to go to sleep and wake up at roughly the same time every day without having a lot of late nights. The consumption of caffeine or alcohol should not occur in the evening up to 4 hours before you go to put your head on the pillow. Don't eat heavy meals in the evening or snacking in the evening 2 hours prior to putting your head on the pillow. You don't really want to be putting anything in your mouth other than your toothbrush when you brush your teeth, because that's also very important. The next thing is something that I struggle with myself because I'm always, catching up on emails and things like that. So having an electronic in your face before going to bed is also very bad for you. So 30 to 60 minutes prior to bed, there should be no electronics in your vicinity. The use of electronics prior to going to sleep has actually been shown to turn off your natural melatonin, which of course we need for restful sleep and for falling asleep. It's also something that my 9-year-old son and we have conversations about that often. Not taking a lot of long naps during the day that could interfere with your regular sleep schedule, unless of course there's a child who is in that nap requiring age group, and those of course would continue to have their naps. So a little bit more about stress. I know talking about stress kind of is making me feel a little stressed out. I hope that that's not happening to y'all. Stress, we know, can lead to sickness. Chronic illness, we know, can lead to stress. So it's sort of this negative loop that we want to avoid. Again, we know that stress negatively affects the normal functioning of the immune system. So by reducing stress, we can improve immune function. It's not going to cure the PID. You still need the treatments that your immunologist prescribes, but by having a lot of regular physical activity, proper sleep, even using other techniques such as massage therapy for relaxation and muscle relaxation, biofeedback, meditation. I mentioned hobbies earlier, like cooking and other things. Social interactions with others. Now that the world is opening back up again, we have no excuse not to be able to do that. And I'm hoping that these events are going to be live again soon. And volunteering, right? So giving back to those who may need your help. And you may say, oh, I'm too sick for that, or oh, I'm too stressed out for that. But there are actually studies that show that the most stressed out person who actually volunteers in something that is of interest to them lowers their stress level, which again, as we know, can help make the immune system stronger. One thing I have found with a lot of my patients with PID, especially because of the frustration of that delay to diagnosis, being ignored, being told, oh, you're just sick all the time, and almost being not bullied, but almost like, oh, you're always sick, right? I find that these patients oftentimes have gotten frustrated to the point where they don't want to ask for help. I hope that by knowing the effects of stress and what we've talked about with stress, that this will motivate you to ask for help. We talked about resources earlier, such as IDF and multiple other places where help can be asked. And if you ask for help and get it, it can help reduce your stress, but it also can help increase your interactions with others. And you may even end up with new relationships and new sources of support that you never even expected. So some other just general health considerations talking about daycare. So daycare can expose to many transmittable infections. We know that infections can reduce the quality of life and impact parents, not only patients if the patient is a child, but patient parents and just patient parents who maybe don't even have PID. It can in fact impact their education, work, and stress level. The exposure to infection tends to be greater in large institutional daycare settings, but it can occur even in small home-based daycare settings. So depending on the degree of immune compromise and the effectiveness of therapy, parents may want to consider smaller options or making sure, again, like especially now that everyone's vaccinated and all of those kind of things that I know you guys got a lot of COVID information on your previous presentation. So I've purposely left it out of this presentation for tonight. But as I always say, you want to discuss the daycare or childcare options with your immunologist because it may be a case-by-case basis. I always tell patients that I want them to be their own advocate, right? I'm sure that many of you on this presentation or on this Zoom have gone to an urgent care or gone to an emergency department or gone to a healthcare provider that just didn't know you. And you're saying, oh, I wish that my immunologists were here, and oh, they're out of town, so I can't get them on the phone, or something like that. And you get in front of somebody who just doesn't know you, doesn't know what PID is, isn't sure how to handle it. I think that keeping a health diary helps not only with keeping stress levels down, because then you're aware of what's going on with yourself and your own body, but it also can help navigate those kind of situations that occur more regularly than maybe we think. And maintaining your medical records in an organized fashion, making sure that you have all of your infections, how those were treated, hospitalizations, current medications, medication allergies, supplements, making sure everything that you ingest is going onto that list. When you've been to the doctor most recently, what were the outcomes of those? Did you have a CT of your chest? What did that show? Having just a real story of your health that not only helps you and helps your family and helps your support structure, but also can help any healthcare provider that may have to come in an urgent situation to help treat you or an infection. I also strongly recommend a feelings diary, monitoring yourself for depression and anxiety, which are very common in all patients who have any chronic disease, and certainly are common as well in patients with PID. By monitoring your own feelings and checking in with yourself every day, how am I feeling today? How do you feel today? Look at yourself in the mirror. How are you? And if you start noticing any signs of depression or anxiety, get emotional support early before it turns into a true generalized depression or generalized anxiety, or before you turn to some of those other things we said you don't want to be turning to, like the drugs and the alcohol. So vaccines and PID, this is a complicated subject. And as I said, I know you guys have already talked about COVID, and I can certainly answer questions about that, but I didn't include it as I mentioned. So, PID and vaccines, a complicated subject. The immune system normally responds to vaccines by fighting off the weakened or killed form of the germ used to make the vaccine. Immunity is the desired end result. And is this a possibility in PID? And we know that it can be, but it depends on the patient, it depends on the immune deficiency, and it depends on the situation. Vaccines use a live, attenuated, weakened, or inactivated form of a virus or bacteria to, quote, trick the immune system into believing that the body is being invaded by the disease, and therefore vaccines stimulate the immune system to produce antibodies. And as you know, antibodies are the body's defense that helps to fight off these infections. And so then later, after a vaccine, the immune system can then learn to recognize and attack the infection if there's a subsequent exposure later in life. But there are some caveats when we're talking about PID. So family members, caregivers of PI patients should not receive live virus vaccines, just as the PI patient themselves should not. And the reason for this is because the virus can then be spread to the individual whose immune system is compromised or absent. So if a live vaccine is required, obviously there's going to have to be an avoidance period from the patient and the person who receives the vaccine. And this is, again, something to discuss with your immunologist as to what that would look like, because that doesn't mean they can never get the vaccine. There just may have to be what we talked about at the beginning, modifications for a time being to be able to have everyone be safe. So unlike live vaccines, vaccines that have been inactivated don't pose as high of a risk. For example, inactivated influenza is a safe alternative to the live flu vaccine, as are other forms of inactivated vaccines. So another big topic, because these are so popular nowadays, are tattoos. So what should I do if I want to get a tattoo and I have PID? Well, my little coined phrase is think before you ink. Okay, I'm never going to tell somebody not to have artistic expression, and it's your body and you can do with your body what you want, but just think about some modifications that you may need to make, because you don't want to just walk into any old tattoo shop and just get a tattoo and not think about your PID. So find out if the tattoo artist or studio that you're going to is licensed and registered in your state. Make sure that there are no complaints against that studio or artist. Local health departments do have a list, and they do have to provide it upon being asked. Ask your artist directly, what are your sterilization processes? If they don't have an autoclave, I would go somewhere else. And if they're not able to explain it to you, I would go somewhere else. You want to make sure, of course, this sounds so obvious, but let me tell you, every slide has a story behind it, and a story of one of these things happening that seems like common sense. But making sure that the artist uses a new sterile needle with every tattoo and wears gloves. You'd be surprised how many tattoo artists don't wear gloves. I've had one tattoo artist who's actually a patient of mine for a different reason, and I was asking him about this subject in preparation for this and other lectures, and he said, oh, it affects my artistic ability to wear gloves. And I said, well, what about the risk of contamination and the risk of infection? Oh, yeah, I remember something about that from that tattoo class I took. So just being prepared. It doesn't mean you can't get a tattoo. It just means you need to modify and think about it. So do you have any risk of infection? Well, there's tetanus and hepatitis B have been shown to be transmitted in an unhealthy or unsanitary tattoo parlor. I say avoid them if you can, but if you really want them because of that artistic expression, go ahead, because I think almost every one of my patients has tattoos, and they can be beautiful. Just make sure that you're careful. So along the vein of artistic expression, what about piercings? There are things to think about with piercings that maybe you've never thought about. So regular old ear piercings, right? You can have allergic reactions. You can have inflammation of the bones in the ears. Earrings can get embedded with fibrotic tissue or scarring, infection, right? Got to worry about that. Keloid formation, that's when you get that scar that's really big and you can't get rid of it. It just keeps growing and growing. Abscesses or walled off infections that can occur. You can get traumatic tears, which then again are also an increased place where an infection can occur. Again, I'm not saying don't get your ears pierced. Mine are pierced right here, but just to think about the things that can occur and make sure that you take precautions so that you can have piercings without any complications. Same things with some of these other piercings that occur in the private or the nether regions, allergic reactions, worrying about whether contraceptives will be effective, infection and keloid formation, particularly for women and in men, frictional problems, infection, and so many other issues that can occur. As I said, this lecture is not your typical lecture because we're getting down to practical things that can affect you having a normal life with PID. So a little bit more about piercings, thinking about oral piercings, tongue, that kind of thing. Some people put them in their cheeks. You need to think about how that's going to alter eating habits. We were talking about how important it is to eat healthy, but if you have something in your mouth that's creating swelling, trauma, it may be painful. You may have a big, bruise or hematoma. You want to be thinking about that when you get a mouth piercing. Infection is always a given when I'm talking about this. But that uncontrolled drooling sounds like, oh, that's interesting. But when you have something in your mouth chronically, it can lead to uncontrolled drooling, which can also be a nidus for infection. Thinking about getting a piercing in your belly button or navel, again, friction can occur leading to infection. You can have an allergic reaction. And there are studies that show that people who have belly button or navel piercings can be at increased risk for an infection of the heart valves or bacterial endocarditis. Same thing with nipple piercings. And then, of course, nose piercings. You can imagine that the infection there, given all the bacteria from the nose and the sinuses draining down, is obviously something to be considered. Also, swallowing can be a problem, and other things. So I'm not trying to talk anybody out of piercings or tattoos. I just want you guys to think about things when you get these things done. So, okay, what about good hygiene? We've survived this pandemic somehow. And a lot of it is because people were practicing good hygiene because it was a very scary time. We're not completely out of it yet, but washing your hands often. Again, just like the breathing, it's a simple, common sense thing, but people forget to do it. Frequent hand washing is critical to prevent the spread of infections. You want to make sure that you know not only COVID, but all infectious disease notices at schools, at workplaces, and making sure that you know the necessary next steps if there is an infectious disease exposure. Making sure that with PID, if you have been exposed to chickenpox or varicella, that you contact your doctor immediately so that you can prevent a serious case from occurring, because if the medication is taken in a timely manner, this can be prevented. And those with PID are at risk for more serious cases of varicella/chickenpox than someone with a normal or intact immune system. We were talking about preparing food and having dinner parties and getting lots of fruits and vegetables. So just making sure that hands are washed before, during, and after preparing food, but also making sure that the food is washed, right? Because of bacteria that can happen during transport and that kind of thing. Also thinking about all these other times to wash your hands. Some of this you're thinking, I'm an adult, I know, but what about training your child, adolescents? I don't know. Again, I have a 9-year-old boy, and boy, he does not like to wash his hands. It doesn't matter what I tell him. So I remind him every time you eat, every time you use the toilet, if you're handling money is one of the dirtiest things that you can possibly handle. If you're caring for someone who is sick, blowing your nose, anytime you touch garbage, anytime you treat a cut or a wound. And we love our pets, but we have to remember that pets have infections that may increase our exposure. And if we have PID, we want to be careful about that. Salmonella is one example of this. So I'm now going to tell you how to wash your hands. And I know you're going to think this is just so simple, but I would guess that if I polled the audience after this and said, how many of you have done it this way? Not many of you will have done it this way in the past. You just wash your hands real quick and you think you're done, but you really need to take a little bit longer. You want to wet your hands, apply liquid or clean bar soap. You want that, if it's a bar, you want to make sure it dries and is able to drain so that bacteria cannot gather on the bar of soap. You want to rub your hands vigorously together and scrub all hand surfaces. So this is not enough. You want to be like a surgeon and wash all hand surfaces in between the fingers, underneath the nails. And you want to do this for at least 20 seconds on each surface so that the scrubbing action of the soap can help dislodge and remove any germs. Then you want to rinse well and dry your hands. And I prefer disposable if possible. I know the environment, but they're now biodegradable. I'd rather that than a wet towel that can then again be another place where bacteria love to multiply and then have a risk of infection from a towel you use multiple times from washing your hands. I prefer soap and water, but if that's not available, you want to use an alcohol-based hand sanitizer that contains at least 60% alcohol to be able to kill most infections. I don't know why the font changed on this one, but other good hygiene practices to consider are regular dental visits, watching out for fungal infections like athlete's foot. One of the most common infections is athlete's foot, particularly if you go to a gym or if your child is in sports and in showers at school or at the gym. Wanting to make sure not to share shoes and socks with friends, keeping nails clipped short and clean, and keeping those feet as dry as possible, making sure that sandals are worn. I travel a lot and I always have my flip-flops with me at every hotel. Other good hygiene, I'm looking at the time, so I'm speeding up. Don't worry, Colleen and others. Avoid drinking that non-purified water that I mentioned. I talked about the bacteria and parasites that you could be exposed to from this. And again, being careful about crowded areas during a pandemic, like we're still in, but also remembering common things like influenza outbreaks and things like that. Sharing of phones, sharing of toys, all of those things need to be washed down. Again, soap and water are fine with me, but just remembering to do it. So good hygiene, thinking about children with PI, smaller classrooms or smaller play groups. That way you can have greater control over the number of exposures to sickness. And washing out minor cuts, burns, or scrapes with soap and water, my favorite, breathing, water, nutrition, soap and water. Keeping that area clean and dry. You can use over-the-counter topical antibiotic ointments and creams as long as you're not allergic to them. Monitoring for any signs of infection, fever, or drainage. Then again, when I talked about that health diary, right? You want to have one for yourself if you're the patient. You want to have one for your child if they're the patient. And you just want to keep a little log of what that little minor cut looks like over a few days, and hopefully nothing will happen, but you definitely want to talk to your immunologist should anything concerning develop. So in this age of superbugs where antibiotics have caused a lot of problems with antibiotic resistant bacteria, we worry about that in somebody without PID. When we talk about PID patients, we want to make sure that we treat cold symptoms aggressively with medications at home and seeking medical attention if symptoms do not resolve in 3 to 5 days. At that point, an antibiotic may be needed and may be prescribed by your immunologist. The reason I say to treat these aggressively early is because the common cold has, gives the risk of increased inflammation, increased secretions, and that's another place where bacteria may want to move in and cause another infection. The common cold is typically a virus that just goes away in a couple of days, but if not treated aggressively in someone with PID, it could lead to a more serious infection. Always have a plan for some of these common things that you will encounter with your immunologist, and never ever share water bottles or other drinks with friends. So Colleen, I don't know if there are children on here. So before I get into the next one, do you want to send me send a chat out and see if it's okay for me to talk about the next subject, which is SEX? I don't see a chat. I don't see anyone talking, so I'm going to go for it. Any kids, go away. We're going to talk about this for a minute. All right, here we go. So, not slides on this one. I took those out in the interest of not being able to see the whole audience. But obviously, you want to be very careful with sex, no unprotected sex, knowing your partner, having potential partners tested for any communicable diseases prior to engaging in any sex, but always being very careful, having it be protected until you decide maybe you want to have a child. And then, of course, you'd want to talk to your immunologist about that, get genetic screening, testing, and that kind of thing. So if anyone has questions about that, we can talk about it. But I'm going to move on now in case there are children there. And I just want to remind you that, again, PID can be a daunting diagnosis. It is a chronic illness, and it is something you do have to modify your life in order to have that normal, happy, wonderful, fulfilling life that you deserve. But it can be mind over matter. So breathing, as we talked about, 4-7-8 breath. I hope you guys are doing it. Meditate. Yoga is wonderful. So many studies on yoga and how it not only helps with physical health, but mental health. Support groups, reaching out to support resources, as I mentioned on one of the previous slides. Monitoring yourself. Ask yourself, how am I doing today? How am I feeling? How's my mood? And what I always say when I'm stressed out is, okay, wait, I got to stop, drop, and roll. Meaning, no, we're not going to let this take over. We are not going to let stress or something that's happened to us change our entire life. We're going to stop, drop, and roll, look around, breathe, and then we can say to ourselves, we got this, right? Communicating, again, as we talked about, talking to your immunologist, making sure that your best interests are being addressed, because every patient is an individual and your interests or your needs may be different from a different PID patient. Making sure that your immunologist talks to you about the studies, new drugs, new formulations of drugs, getting that support, planning for things, that urgent care visit, that tattoo you might want. But know that you can have a normal life, but make sure you don't forget to breathe. Coordinating with your nurses, your IVs, your immunologist. But one thing I always like to remind you is that your immunologist is your gatekeeper. Your immunologist understands your PID probably better than any of your other healthcare providers. But your other healthcare providers are so monumentally important. And you want to make sure that they're coordinating care together. Your PCP and your immunologist should be talking, your psychologist, your therapist. Make sure that everyone is on the same page. They all know about your health diary. They all have the same summary. They know who you are, because your health is only going to be better the more your healthcare team communicates. So prior authorizations for medications are a pain in the rear. So a lot of times, these can take 24 hours. They can take 3 days. They can take 7 to 10. It depends on the insurance company. It depends on how difficult the insurance company wants to be. So the more you can help your immunologist and your team with the prior authorizations, providing the information from your health diary, how many infections you've had, what worked in the past, what hasn't worked, why this gamma globulin isn't working and it was before. Making sure that you remember that prior authorizations are the bane of all of our existence, and teamwork is the best way to approach these, so that the insurance companies will just provide the medication that is needed without giving us so many headaches. And of course, whenever I am involved in a prior authorization, I breathe. So I appreciate everyone's time. I went over a few minutes. I'm so sorry for that. But I'm happy to take questions, and thank you.
Well, thank you very, very much. That was very informative and very, very good.
Wonderful. Well, thank you for having me, and I'll be here for questions if anyone has any.
Me too. We have a few that came in, and I have a couple that came in before that. So we have a few questions, and they're kind of really some interesting thoughts and questions. So I think a lot of them have to do with GI issues or food issues. So I think we'll go through those. The first one is, do liver cleanses make sense for a PI patient?
So, so liver cleanses, I would again refer back to what I said, that supplements, I would put that under sort of the supplement category. They can be helpful because, again, as I mentioned, like when I said about fiber and those kind of things in the diet, you want to get as many toxins out of your body as possible. But there are some liver cleanses on the market that are dangerous. So you definitely don't want to just go get something over the counter and think it's going to be fine, because there are also some PI conditions that can lead to liver issues. There are some medications that have liver toxicity already associated with them that you may or may not be on. So a liver cleanse could actually be dangerous. So this is a time where, again, I go back to my normal answer, which is talk to your immunologist to make sure that all of your supplements are listed and known because of those interactions that can occur. Make sure you know from your own health diary your GI status, your liver status, so they can be helpful with care.
Sounds good. What about intermittent fasting?
So intermittent fasting is something that can be helpful with trying to have weight loss, but it's something that should be a short-lived endeavor. And again, if I refer you to my nutrition slides, if you eat a healthy, balanced, anti-inflammatory diet and eat in moderation with fruits, vegetables, having that colorful plate, there's really no reason to do it unless you're morbidly obese. And at that time, I would talk to your immunologist, and I would also have a nutritionist on board. But again, the energy that I find that people spend with liver cleanses and intermittent fasting and, oh, what about this diet? Or what about this new cool thing? All of that energy, if you spent it on everything that I talked about, breathing, hydration, being careful about what kind of foods you're eating, if you do all of that and spend that energy on those things, we know that those work and we know that those are safe.
You mentioned the anti-inflammatory stuff. I've had several people ask for you to talk about the book you recommended.
It's the anti-inflammatory diet is actually it's just a 2-page document that you can find on Dr. Andrew Weil, W-E-I-L-L, on his website. And it just talks about like a daily, what you should eat and drink in a day. So it talks about how many fruits and vegetables you should have, how much meat or protein, if you're a vegetarian, that you should have. Dark chocolate is on there. If you are going to have a small amount of alcohol, red wine being the option there. And it is on one of my slides, but for some reason it doesn't always transmit technologically. I need a technological assistant. But I can provide that to you, Colleen, if you want. Okay. And you could then distribute it to the participants.
Yes, that'd be great. Thanks.
Yes. It's very simple. It works. You can modify it for children, modify it for somebody who may need more calories, somebody who's trying to lose weight. It's very easy to modify, and it's easy to follow. So again, instead of spending energy on this new thing or this fad, it's simple and it's proven to work.
Well, that's good because we've had several people ask about it.
Okay, so I will send that over to you after this is over.
Okay, sounds good.
Okay.
The health diary you were talking about and the kind of monitoring things. Are there any apps that you use for either mental health or dietary or even your health records?
So again, I think that Andrew Weil's website is very good for lots of the nutritional things, the meditation, the mindfulness, there's yoga on there. A lot of things are on his website, and it's essentially free. Now, he does sell supplements on there, and I don't make anything from him, and I'm not suggesting you buy the supplements there, but he does have a really cool part of the website where you plug in information about yourself, and it points out your nutritional deficiencies and where you may or may not need a supplement. That would be interesting for patients to do, and then bring that to your immunologist and say, okay, this is what this said. What do you think? Or you could also think about how you could supplement your diet to make up for those issues. As far as another mental health app that I also do not endorse, nor do I make any money from, I really love the Calm app. It's an easy app to use. It has hypnosis on there, meditation. It has things that you can listen to when you're trying to fall asleep, if you have trouble falling asleep. There's great music on there. There's yoga on there. I know that this offer is gone, but they just did a lifetime, like $59 for your whole life. But I think they might bring it back now that COVID is going away. So I love the Calm app. As far as the health diary, I have not found an app that I like. If anyone out there knows of one that you could introduce me to, I would certainly love it. But I just say break it into sections that are easy to navigate. So infection history, radiology, urgent care visits, birth through now, so that somebody can see your whole history. People have it on a binder, but you obviously electronic. I have people pop up with, they have graphs and they have tables and they have all of this kind of thing. But I have not found a single resource on that I like. But as far as the nutrition, the mental health, I like the Calm app and I like Dr. Weil's website. There's a lot of information there.
Cool. Thank you.
You're welcome.
I had somebody that said for managing inflammation, when you have a bleeding disorder, their bleeding disorder gets worse with anti-inflammatory foods like ginger and fish oils.
Right.
And then there was somebody else that said, can ginger thin your blood too much?
Yes. So if you have, that's why I always say speak to your doctor, because I'm giving general thoughts and general health considerations, but every patient is an individual. So clearly, if you have a bleeding diathesis, you definitely do not want to have too much fish oil. You do not want to have too much ginger and other supplements that can also affect bleeding. But there are other anti-inflammatory supplements that can be taken that don't have the effects on bleeding. So that's again where a nutritionist can be helpful, because like, let's be frank, and there may be immunologists on this call, and if so, with all due respect to my colleagues, you know, we're not nutritionists, right? So I know a lot about it because I did the Integrative Medicine Fellowship, I boarded in it, and it's a passion of mine. If your immunologist doesn't know, that doesn't mean your immunologist doesn't, you know, isn't smart. It just means that that's not their area. That's where a nutritionist may be very, very handy. And I would definitely go to a nutritionist that's affiliated with a medical center or a medical office. Not just a nutritionist that's online, or, you know, just one that's got their own little office, only because they may not know about PID. So you want an immunologist that's open to nutrition, and you want a nutritionist that understands a little bit about immunology. Again, that team approach I mentioned, I think it was on one of the last slides. I have a nutritionist in my office, so when I don't know the answer, I'm like, go talk to her.
Cheating.
Well, you know, there's only so much that can be in this one brain.
Now, I'm not sure about this one because I'm not familiar with what they're referring to, but will low-calorie body armors be good to drink when you have PID?
Low-calorie body armor, is that a brand of a drink?
I'm not sure. I'm not sure if they're going like with low-calorie Gatorades and
you definitely want to minimize sugar. So anything that's going to minimize sugar, but I didn't really mention too many of those kind of drinks because so many of them have artificial sweeteners or artificial flavorings in them, which I really try to avoid as much as possible, that preservative processed kind of food. So just diluting down some tea, diluting down some fresh juice, and, you know, you can squeeze your own juice, and then, you know, it's really organic and healthy. So I'm not saying no, just like I didn't say no to tattoos and piercings, but the healthier, the better. And so if it's orange and it's fluorescent orange, that's not the same color as an orange, right? So that makes me wonder always what's in it. So proceed with caution. And I know it's going to sound strange when I say this, but like, ask your immunologist and ask the nutritionist. But use that energy and use that money on the healthiest, most natural thing instead. Because 2 oranges that you squeeze freshly and dilute it with water would be much healthier.
Mm-hmm. Absolutely.
And you also don't want to get too many vitamins. Just as a caveat, there's some of those electrolyte drinks and things that you can drink that have a lot of vitamins in them. Like they'll have 4,000% of what you need as far as vitamin whatever. Some of those vitamins you may just urinate out because your body just says, I don't need that, and they go out. But some of them you have to be careful because you can get too many vitamins. And we were talking about the liver earlier. If your liver is not 100%, you can get into trouble. And all of this is not meant to scare you and make you go, oh my God, there's so much to process. It's to just remind you that sometimes convenience of something in a bottle may not be the best.
Well, that's interesting because somebody had asked a question about for severe life-threatening allergies, would vitamin C IV boost their immune system?
So there are some studies about vitamin C and immune boosting, yes, but you know, you're already intravenous preparations of anything you want to be careful with. You want to make sure that if your vitamin C is already normal, you don't want to overdo it. Vitamin C can be caustic on the veins, and if you're on immunoglobulin that's intravenous, you may want to save your veins and not have anything go into the veins that could cause trouble or trauma or inflammation that could then prevent you from getting the treatment that you need. So in some cases that may be helpful, but it's not a blanket yes.
Okay. We're going to switch categories now. We're going to hit some medical questions. So one of the questions that we received was, are there alternatives to IVIG or sub-Q IG?
In patients who do have no antibodies or not enough antibodies, don't produce enough antibodies, unfortunately, not really, other than bone marrow transplant. So, hey, you got a black and white answer for once. Are you shocked?
I did.
Wow.
I did. I'm impressed.
I wish there were a magic something else, but no.
Yeah, you and me both. Can you talk a little bit about acupuncture, and do you know if it helps with fatigue?
Yes, so I also have an acupuncturist, so I am very much aware of the literature on acupuncture, and it's one of the things that many of my patients, PID and non-PID patients, do gain benefit from. So there's a lot of studies, there's a lot of literature. Fatigue is one of the things that does absolutely help. But with PID, you want to be careful because acupuncture is, of course, a foreign, foreign object being introduced into the skin. So just like with tattoos and anything else, you want to make sure that it's done in a medical environment that is using all of the right sterilization techniques, making sure that each needle is packaged separately, because there are some acupuncturists who use needles in bulk that they open and close and open and close and open and close. Our acupuncturist uses each needle is opened and it's after it has been sterilized. You want to make sure that gloves are worn, alcohol swab, all of those things that we talked about with tattoos basically are the same with acupuncture. But acupuncture has helped with fatigue. It helps with pain. It helps with stress, which again helps with everything as we talked about. It can help with anxiety. It's been shown to help with depression. Acupuncture is amazing if done correctly with the modifications and thought process needed when you are a PID patient or your loved one is.
How about reflexology?
Well, reflexology is pretty benign. I mean, there's not a lot of invasive stuff going on there. So I am a big proponent of reflexology, as long as there's always a caveat, Colleen, always. As long as there's no musculoskeletal problems, rheumatoid arthritis, things like that you might want to be careful about being manipulated with reflexology. But other than those kind of caveats, or infection in the skin around the foot. So taking those things aside, I think it's great. It's the same as I think for massage therapy. Now, massage therapy, you gotta be careful if you have a bleeding disorder or a clotting disorder because of deep tissue. You want to be careful. So yes, I'm a proponent of that.
Sounds good. And I think those are things that people struggle with and don't think about as an option for treatment, especially with fatigue.
And I think that people, with fatigue, I'll be very candid. And I will tell you that when a patient goes to most, not all, but many healthcare providers are like, oh, fatigue. What am I going to do with that? Okay. Because fatigue is a hard thing to have, but it's also a hard thing to treat. And it's one of these complaints that it's like, oh gosh, okay, here we go. It's going to take a long time. And, but it's not always that complicated. And if you have PID, of course you're going to be fatigued, particularly if you need an infusion, or you just got your infusion, or you just had an infection, right? So when all the common things are ruled out, thyroid disease and others, it's time to think outside the box, which really I like to say, which is inside the box, because integrative things like reflexology, acupuncture, exercise, all of these things that help fatigue are really pretty benign, or pretty safe is a better word.
So
8:31. I've got only time for maybe one more.
Yeah.
My child has been very patient with me during this. And he stands at the door and is like, Mom.
Well, and we're not answering or addressing COVID questions tonight, because that's going to be a big session at the PI conference.
Exactly.
But there is a question that's been asked both before and during tonight's forum that I think applies no matter what, whether there's a pandemic or not. If you are alone living alone. You don't have family that live near you. We are a global society now. We don't necessarily have mom and dad right down the street.
Right.
How do you recommend, what kind of social interaction methods do you recommend for people who may not have a church family, but they live alone, but they want to meet other people? Any ideas?
You know, it's a really great question, because I think that COVID has isolated all of us, right? And I think, again, having a chronic illness can be isolating as well. There are a ton of local, regional, and of course, national support groups out there. Forums like this, you know, talking to people, maybe you see somebody on here that's interesting. I find that I'm not promoting religious or non-religious things, because I don't do that. But there are certainly, just like there are churches you can go to, there are non-church groups in most cities. I know there are some in Charlotte where it's just a, let's get together. They've been doing them on Zoom during the pandemic, and I know that they're doing them, starting to do them live now. Facebook is a good place, and I'm not promoting Facebook. I know some people call it Fakebook. This is just me trying to give ideas. There are tons of different groups on Facebook where, let's say your interest is knitting. There's a knitting Facebook group that may be in your area, and then you may make friends there. I'm telling you, if you look at those groups, there's everything. There's the I love Charlotte. I love Charlotte from 1970 to 1980. I like Charlotte in 1950. I mean, the number of Facebook groups is astronomical. And there are other social media sites like that. Now, if you don't have the internet, then I say get out to a park. You know, in a pandemic, wear your mask, but, you know, get out to a park. Go to the, now that we can go out again, you know, go to the grocery store during lighter hours. You never know who you're going to meet. You know, I'm the kind of person where I'm get on an elevator and I'll talk to the people on the elevator, because you just never know. I mean, and I have made friends in the strangest places. The people are often like, oh, is that your friend, another doctor? I'm like, no, that's my friend, the chef, or no, that's my friend, that, you know, no. So you just have to kind of take a little initiative too, and it can be scary. But those are some of my ideas. I hope they were helpful.
No, I think they are. I think they're good. But I think when you're alone,
it's hard
to kind of think outside the box.
You know, and one thing I'll say too is that I think when you are alone and maybe a little isolated, you may forget that you're actually really interesting and you have a lot to offer yourself. So it may not always be that you're looking for someone to give to you. You may go give to someone else, and then the connections can be endless. So that volunteering thing that I mentioned, you know, you may say, I'm so lonely, I'm isolated, I've got this PID, this stinks, I'm going to sit in my house. Well, no, why don't you get out there and say, you know, I care about children with hunger or whatever. You never know. But volunteering, the rewards that you give, you get 10 times more back.
I think that is an amazing note to end on tonight. Right. And I can't thank you enough for volunteering your time to put together this presentation and to be here tonight and give us the wisdom that you have. So thank you very, very much.
You are welcome. Thank you. It was an honor to be here. And I'll send you that diet, okay?
Thank you very much. And with that, I'm going to turn it over to Kathy.
Thank you, Dr. O'Connor. Amazing information. And again, at this time, I would like to thank all our sponsors. And once again, thank you. Thank you, everybody who hung in there with us tonight, who joined us. We hope you found the information helpful. Please remember, IDF is here for you every step of the way on this journey. We will see you next week and look forward to seeing you at the IDF Primary Immunodeficiency Conference, June 23rd to 26th. Meanwhile, we care about you and take care of yourself. Good night.